with those photos?
Yes, I am.
And can you tell me what they are? Just generally speaking, not specific.
In general, they're autopsy photographs. They're photographs taken from at various times during the autopsy. In addition, there are some diagrams toward the back of the package here that depict the heart.
Are you familiar with all of those documents or those exhibits I just gave you?
Yes.
Okay, thank you. Your Honor, I'd ask the court to receive them, and then I'd ask permission to publish. One will be on the screen, and then the remainder I will ultimately hand out the purple files to the bailiff.
Any objection from the judge?
No objection.
All right, so this was 60 through 68?
Yes.
Okay, those are all received.
So, Dr. Kelly, you talked about the first one being the transport bag. Is that exhibit number 60?
It is.
Okay, I'd like to be able to put 60 on the screen. Now, with that transport bag, is there information contained on there that we see?
Yes.
And what might that be?
This tag is from the Allegheny County Coroner's Office, and it depicts the demographic information, or like, as you say, the vital information about the person.
And on this particular one, is there an indication that it is the transport bag for Joseph Carot?
Yes.
And does it indicate a date of death on there?
Yes.
And what might that be?
It's July 19th of 2024.
There also is a red tag that we say that actually says sealed on it. Do you see that?
Yes.
And what is that?
Well, that's a bag seal. So what that effectively is, it's kind of like a fancy zip tie. It's plastic and it has a unique identifier on it, and that's something that can be recorded by the coroner's office. And much in the same way that if you're following a truck on the highway and you see that little tag on the back, it doesn't prevent somebody from getting in there, but it will tell you that the seal has been broken, that somebody may have been able to get inside. So finding an intact seal means that the bag has been closed since the seal was applied to the bag.
Thank you. And were there any issues with this particular bag at all?
No.
Thank you. Judge, I'd like to provide the folders to the bailiff.
Once again, those folders will be passed out one by one. And don't open those until instructed. So we'll wait for each juror to have the folder. Get some up front, maybe, so. Okay, the record should reflect that all 14 jurors have a purple folder with certain exhibits in there. Not to look at those until instructed during the witness's testimony.
All right, now, Dr. Kelly, you talked about how during the autopsy process, the first thing you do is an external examination of the body.
Yes.
And part of that is observing any wounds or injuries or disease that might exist. Is that fair?
Correct.
Okay, so in the photo that, or I'm sorry, in the exhibits that you have, if everybody could turn to exhibit 61, it's the first photo that's in the packet. And if people could just turn to that one, and then we'll talk a little bit about that, and then we'll cover that photo back up. But in this first photo, 61, do you see some black box that's kind of on the top and the bottom portion of 61?
Yes.
And is that just to help, kind of cover to make it a more sensitive photo?
Yes,
So in the original photo you took, it would have been the entire picture without the boxes, is that fair?
yes.
Okay. Now, when you're observing this photo, and you're conducting your autopsy, what was the importance of observing, this particular documentation?
It's to document the entire body. In this photograph, it shows the head and the torso. And within this photo, you can see the injuries to the chest area.
Now, I'd like to talk a little bit about, we see an injury if we're holding the photo kind of up and down where a person's head would be on the top. The injury on the right-hand side, kind of under that left breast area. What did you observe from in this photo with that injury?
Yes, in this photo to the left side of his chest, under the left nipple, that is a stab wound to the chest.
Now, we see some kind of injury in the middle, in between, kind of on the breastbone, and then we see kind of a curved injury kind of to the left of that in the photo and above that. What is that from, if you know?
The rest of the injuries that you're looking at to the chest, you notice that they're kind of in the midline and they have something of a pattern to them. They have a curved nature. These are injuries that are related to resuscitation and are either, and could be a couple of different things or both. One is defibrillator pads. It could be burns and abrasion from the defibrillator. Also, if a Lucas device was applied, this is a piece of mechanical equipment that does CPR for the rescuers. So it actually takes the work of the actual compressions of the chest away from the rescuer. So because it's curved and round, that can be one or both of those medical interventions.
So for those particular injuries from the medical intervention, was that any concern to you related to cause of death at all?
No, they're not related to the cause of death.
So you would still even though they're not related to cause of death, you would still document them as part of what you're seeing on an individual?
Yes, despite obvious evidence of injury or obvious evidence of a cause of death, I still document everything at autopsy.
Okay, thank you. So if we could close that photo and then look at photo 62, or exhibit 62, I should say, which should be the next one. And if we kind of put it where it would be up and down with the head on the top and the lower torso or stomach area on the bottom. Is it common for you to take kind of more general photos and then focus in on specific things of interest to you?
Yes.
And is that what you did with exhibit number 62?
Yes.
Okay. What do we see in exhibit number 62, more close up?
So in this photograph, you can see the left nipple in the photo, and below that you can see the stab wound that I referred to earlier.
When you look at that stab wound, what is it you do to try to assess it?
Well, I describe it, I measure it on external examination, and look for any other injuries associated with it, any injuries around it.
And you did that in this particular case?
Yes.
All right, then if we could look at exhibit number 62. I'm sorry, 63. And if we could look at it in a way that ME 244848 is kind of vertical across the page so that we're able to see that. Is there a significance to that number, ME 244848?
That's our unique identifier. So that's the number that we give to the case at the Milwaukee County Medical Examiner's Office to, to tell it apart from other cases.
And what does this, I see that, that identifier also kind of has a measurement on either side of that identifier as well. Can you use that in terms of measuring as we're seeing here?
Yes, the purpose of taking photographs with a photo label is that it not only does it give an identification to the photo, especially to close-up photos like this, but also gives a scale that somebody looking at this photograph could use to determine the size of things in the photo.
So approximately how long is this injury, this wound?
I believe I measured the wound at a total of 6.2 centimeters, which is effectively it's about 5.5 inches.
Okay. And as you're doing that, is it common for you if you see a wound to try to kind of put, if you will, kind of the skin together to kind of analyze it or look at the edges of the skin and what that looks like?
Yes.
Why do you do that?
Your skin has elastic fibers in it, and they actually run in certain orientations, so they run in certain directions. And if you create a stab wound across those elastic fibers will contract and will cause that wound to open up wider. It'll make it look like a gaping wound. If you create that wound in parallel with those elastic fibers, it'll kind of stay together more. And then of course, everything in between. So when we have a wound that's kind of gaping or wide open, in order to measure it better, it's a lot easier to put it together and measure it that way, so that we get an accurate measurement.
Thank you. And then if we can look at Exhibit 64, are we able on 64 to be able to see you kind of doing that with maybe a finger in there, kind of on the side of the body?
Yes.
Okay. So as you observe this injury, did you notice anything, or are you able to notice anything externally on kind of the shape of the wound?
Yes.
And what might that be?
So some stab wounds are the stab wound itself. They are just a cut or a single defect, linear defect. Other stab wounds, they have additional injury or sharp force injury that is related to either the part of the insertion of the knife or the removal of the knife. So in other words, knives have sharp edges. So if you put it straight in and pull it straight out, you might get just the slit that represents the width of the knife. But that doesn't always happen. Sometimes if there's movement to the person's body or movement to the knife as this is taking place, you can get additional injury to the wound. So it can look something like this, in which it's kind of a wide angle V shape. It almost looks like as it was being inserted or removed, the edge of the blade created additional cutting to the skin. So instead of just having a very simple in and out slit-like stab wound, you have a more complicated wound where there's an incised area.
And then can that also then impact what you see internally?
Possibly, because the same cutting surface can glide across soft tissues underneath the skin. So the wound inside can actually be much longer than the knife.
Thank you. So at this time, if everybody could put their photos back into the purple file, I think we'll continue on with additional testimony. So as you saw the
Okay, the bailiffs can have their seats. You're gonna have them refer back to those at some point?
I think we'll leave them with them for now until the
Okay.
conclusion of the testimony.
Sure.
Thank you. As we talk about the external examination, once you're done with that, which includes going through the photos and the documentation we just did, then do you continue on, as you said, to the internal examination? When you did the external examination, was there anything else that you found externally on Mr. Carnot's body that you then reviewed or focused in related to the internal version of the autopsy? External injuries or disease or anything?
The only other injury they had on the external examination was a small abrasion or scrape to his right knee.
Okay. So as you conduct the internal portion, what is the next step that you go through regarding analyzing this particular injury from an internal perspective?
Well, simply put, I track the wound. I look at the injuries underneath the skin and make note and document what structures are injured by the blade of the knife. So that includes the rib cage, that includes any of the organs underneath. I look for evidence of hemorrhage and document that as well.
And in looking at that, what is it that you learned about that particular stab wound that we just saw externally?
So this stab wound actually, it goes through the rib cage. It goes through the rib cage in an area that's predominantly cartilage. So you might imagine that your ribs, they don't go straight, they're not horizontal, they actually have angle to them. And at the bottom of your rib cage, on the anterior surface of your body, at the bottom of your rib cage, the ribs kind of come together and join. But they don't join as bone, there's cartilage there that connects them. So to the left rib cage, he had the stab wound went through that cartilage between the 6th and 7th rib, or involving the 6th and 7th rib. There was also some hemorrhage to the soft tissues behind the sternum. So hemorrhage dissects its way along the soft tissues. And then right underneath that is the pericardial sac. The pericardial sac it's a sac that surrounds the heart. And the heart beats and moves within that sac. And typically that sac doesn't contain any fluid, or contains very minimal fluid. When you find fluid in the sac, that is cause for concern. And in this particular instance, he had a large amount of blood filling and distending that sac, and that's important. The amount of blood, by the way, that's in that sac is about 300 milliliters or cc's, which a can of soda is for reference, a can of soda is about 355 milliliters. So it doesn't seem like a lot of blood, but the fact that the sac is not there to accommodate that blood, that's the important issue in Mr. Carnot's death. The heart, as I said, it moves within the pericardial sac. It opens up so that blood fills the chambers of the heart, and the ventricles of the heart fill with blood, and then they contract, and that blood gets pushed out through the large vessels all over the body into the lungs. If you do anything to impede the heart's ability to open up and receive blood, you impede the heart's ability to move blood throughout the body. So you can kind of think of it as, slowly, if you fill that sac around the heart with blood, you're sort of strangling the heart. You're taking away its ability to effectively pump blood to the rest of the body. which obviously is what its function is. So at some point, the heart is going to fail because it's no longer able to perform that function. In this particular instance, Mr. Carot had a stab wound that caught the edge of the right ventricle of the heart. And that opened up a small opening between the chamber of the heart where the blood is at and that sac around the heart, which is where I found the collection of blood. So as you can imagine, with each beat of the heart, blood is being forced out of that small defect to the wall of the heart into that sac. And so eventually that's going to fill up, heart is going to fail, and he will die from that.
Now, to be able to understand that, is it helpful to sometimes look at it at an anatomy diagram?
Yes.
So I'd like to have you focus on the diagrams, which I believe, if I recall correctly, should be exhibits number 65 and 66, 67 and 68. Does that look about right?
Yes.
Okay. And I'd like to provide you with a pointer, and then I'd also like a microphone, Judge, if that's okay. We're upgrading from the measuring stick we used last week. And so I'm going to give you that as well as the microphone. And if we could put exhibit number 65 on the screen. Are you familiar with this photo?
Yes, I am. Yes, I am.
Okay. And are these photos that you actually provided to me in anticipation of trial?
Yes.
Okay. You want to tap the top?
It seems to be working.
Okay, perfect. All right. If you could just kind of describe what this anatomy drawing is as it relates to what we're talking about here.
So I chose this because it focuses on the area of interest. So this is a diagram painting that was created to show the heart, the lungs with the anterior chest removed. So on the edges here, you can see the ribs, and it's as if those have been just removed, taken away, so that you can see all these structures. So this gray thing around the heart is the pericardial sac. So you can see there's this sac surrounding the heart as I described it, and this is the heart inside.
And as you point to that, that's kind of in the middle of the photo, would you say?
Yes.
And it's identified?
Yes.
Okay.
These, over to the sides, are of course the lungs, and the blue and red, they're that color to tell you the difference between oxygenated blood and unoxygenated blood. But these are the great vessels, the aorta and the superior vena cava.
Okay. Now, if we look at exhibit number 66, is that the same photo that we looked at before, but with an additional notation on it?
Yes, this is the same diagram. What I've done is I've given you an idea about where the stab wound to the heart was located.
And where, can you point to where that is?
It's right here. I have an arrow and an asterisk pointing it out.
So when you talk about that sac with that heart, and we're kind of looking at that diagram, it looks like the lungs and the heart are really quite close together. Is that pretty fair?
Yes, they are.
So as somebody is breathing and their heart is pumping, you talked a little bit about all of the expansion and the movement that's happening in there. Is that fair?
Yes, there is considerable movement within the chest cavity due to the heart and lungs.
When the lungs when you're breathing, are your lungs also expanding as they fill with air?
Yes,
So the lungs are expanding and then deflating as you're breathing, and then the heart is pumping, so it's expanding and then getting smaller with the pump. So there's lots going on in that particular area of the body at all times.
yes.
Okay, you pointed on the right-hand side, the rib cage, and you talked a little bit previously about cartilage. When we talk about that, how would we think about kind of the thickness of skin. What's cartilage like as you're examining it in terms of the difference maybe between skin or how we kind of understand it?
So cartilage is not as dense as bone, but certainly much more dense than the skin and the soft tissue underlying it.
So as we talk about stab wounds, in order to kind of go through cartilage, is that just an easy kind of stab, or does there have to be an amount of force to get through kind of that cartilage area from the density of it?
Well, common sense, it's much denser, so it will take more force for a blade to go through cartilage than skin. It's important to point out that in terms of blades, the blade is sharp, so it will go through lots of things. All you have to do is overcome the resistance of the skin, and underneath there, everything else is pretty easy to cut through. Cartilage would create a little bit more resistance due to its density in its composition. And then of course, bone is very hard, and that would create a lot of resistance to a blade passing through it.
So as you looked at Joseph's body during the autopsy internally, were you able to see the direction in where that knife went through in the cartilage?
To some extent, I mean, obviously I can tell that there's 3 dimensions. And when we describe, certainly when we describe gunshot wounds, for instance, we try to describe them in those 3 orientations, whether it's front to back, left to right, right to left, and whether it's up or down in orientation. Sometimes it's not possible. And sometimes, such as this case, it's kind of difficult. And when I have a level of uncertainty about it, I won't hazard an outright guess. So in this case, I know that it's front to back, but because of the movement of the heart and because of the size of the injury to the overlying cartilage, I didn't give an opinion on whether or not this pathway is left to right, right to left, or whether it's up or down. I think it's just too difficult to tell.
All right, if we could then look at exhibit number 67. Could you describe what 67 is of?
This is just another diagram just showing the heart, and again, I just wanted to do this to demonstrate the location of the injury. So this is the right ventricle of the heart over here, the left ventricle of the heart over here, and the injury is going to be down here at the bottom, or in some sense you call it the lateral or the side of the left ventricle. The heart actually kind of sits on its side, so to speak.
So if we look at exhibit number 68, did you make a notation on here to help us understand where?
Yes.
And where is that?
Again, I just put an arrow and an asterisk to demonstrate the relative location of the injury.
Okay, thank you. If you'd like to have a seat, you can. So as we talk about this injury, fair to say that there's some injuries that kill someone immediately and some that take time.
Yes.
And how would you describe this particular injury?
Well, this injury is not necessarily an immediately lethal injury. It's, as I said before, it's an injury that would allow for the accumulation of blood into the sac around the heart. With each beat of the heart, more blood is entering that pericardial sac.
So would somebody maybe be able to move around for a little bit?
Yes,
Would someone maybe be able to talk for a little bit?
yes,
Eventually, might that person become unconscious?
eventually, yes.
Is there a scenario where they might become unconscious, then come to a little bit and become unconscious again?
I suppose that's possible.
Okay. Now, with this type of injury, as we're talking about kind of the process of the blood filling that sac portion of the heart, and it not happening, it's not causing death right away, how much time might it have, give or take? Not, obviously, there's not gonna be an exact situation, but generally speaking, what might it look like?
Yes, that is going to be difficult. It really depends on a lot of factors. One being the size of the defect, but also how fast the heart is beating, what the blood pressure is at that time. So it's difficult, but certainly it can happen within a matter of less than a minute. But it can also, an injury like that could allow somebody to remain alive alive meaning their heart is still able to beat for several minutes.
During that time, it would be pretty critical to have immediate emergency response.
Yes.
And what type of, with this particular wound and this particular stabbing, what type of things might the person be experiencing while this is happening? After the stab wound, but before they pass? What might that look like?
Symptoms that they might
Yes,
experience.
symptoms, sorry.
As I said, as the blood fills the sac around the heart begins to fail. That person would, certainly start to experience the effects of that. Things such as dizziness. They certainly could become move in and out of consciousness, but certainly dizziness. They might have a little bit of chest pain, and then of course, because the heart is failing, they probably would experience some shortness of breath at some point before they pass.
If you are around someone during this time, would it be pretty evident that a person would be in need of dire medical care?
Yes, they would be in need of immediate medical care.
And if somebody is checking their pulse, would their pulse at that time might feel weak or might be faint?
Yes, at the end, when the heart stops basically beating and forcing blood through the arteries, which is what creates your pulse would become weaker and perhaps thready, so that it's difficult to even palpate.
Now, if I could bring your attention to exhibit number, I think 59, that was your report?
Yes.
Okay, if we could just look at exhibit number 59 and we look at page 3, do you see a section called evidence of traumatic injuries?
I do.
Okay, and is this where you're describing what you're seeing related to this knife wound?
Yes.
Okay. You talked a little bit about the wound, and I think that you note that in here, and we talked a little bit before about it, but I kind of want to come back to it. Did you describe it specifically in terms of kind of the length?
Yes, I did.
And what did you say regarding that?
So the total length is 6.2 centimeters, which is divided into two portions of, as I said, a wide angled V-shaped injury. And 6.2 centimeters again is about 2.5 inches.
Okay, and you talked about how it was comprised between like maybe a 4.2 centimeters wound and then a 2 centimeters wound. And then can you describe that portion, what you mean by that?
So what I'm describing is there's a portion that's oriented slightly downward toward the midline, just off of the horizontal. And then there's away from the center of the body, the outer portion is more horizontal, and it's a 2 centimeter portion. So there's a stab wound with a separate area that's a little different in orientation, hence the V shape that I was describing.
Okay, I'm gonna approach with another exhibit. Exhibit number 77, can you look at that?
Yes.
And are you familiar with that, what's photographed in that exhibit?
Yes, I am.
And what is it?
This is a photograph of a knife that was shown to me as the potential knife that caused the injury.
Your Honor, I'd like the court to receive exhibit number 77, and I'd ask permission to be able to publish it.
Any objection? No objection. Right.
Exhibit 77 is received.
Dr. Kelly, is the photo that you see above you also consistent with what you're looking at?
Yes, it is.
Okay. Now, are there times when you're doing an autopsy that someone might bring in an object related to death?
Yes.
And what is it that you talked about this knife being brought to you? What is it that you do when you're looking at the knife and you're conducting your autopsy? How do you go through that process?
Simply put, I just documented. I photo documented. If possible, I can take measurements. If the knife hasn't been processed, if it hasn't been, if it can't be touched, that makes it more difficult. But if not, I can at least take measurements and take photographs.
When you did in this case, again, this is one of the photographs that you took related to the autopsy.
Yes.
And what was your analysis when you're looking at this knife related to the wound?
I measured the length of the blade and the width of the blade. I note whether or not it has one cutting edge or two cutting edges, whether or not there's a cutting edge at the tip, a variety of things of that nature. At the end of the day, what I am able to tell people about knives is not necessarily whether or not this is definitely the knife that caused this, but whether or not this knife could have caused the injuries that I'm looking at. So there are times when I receive more than one knife and have to do this with all of those knives and determine how many of them could possibly have created the injuries. In this particular case, there's only one stab wound, and there's just one knife being presented to me, so that's what I did.
And did this knife look consistent with a knife that could have left the stab wound on Joseph Carot?
I believe that I said that this knife could have created the injury that we see.
Now, in stabbing type cases, are there times where just a portion of the blade might cause somebody's death, or is it something that you'd have to use the entire knife blade all the way up to kind of the plastic handle portion of the knife to be able to cause a death? Do you know?
You mean?
In general.
In general, we also will try to make note of whether or not, I think what you're referring to is the depth of the injury.
Yes.
So we try to give some idea about what kind of depth we're talking about. Obviously, we have to take a few things into consideration. For instance, with the chest and the abdomen, the surface is compressible. So you can see a wound path that's even longer than the knife because the blade gets compressed and the knife goes in technically farther than it would have otherwise. The blade can only go in part of the way, and that's another possibility, that it's only inserted partially. So we'll do our best to try to determine, and I did my best to try to determine something about the depth of the wound. Sometimes that's not something that you can speak to a reasonable degree of certainty, but I certainly try to take photographs so that can be entertained later on.
In this particular situation, was that difficult to be able to determine based upon the fact that the heart and the lungs are all beating and breathing and expanding and becoming smaller during that time?
Well, that's certainly a consideration. The other consideration, like I said, is whether or not the chest wall is compressed. But certainly suffice it to say that this knife could have been inserted the entire width, or based on the measurements and the appearance of the body, it could have been part of the distance of the width. Part of the length of the blade.
When you say the chest is compressed, what does that mean?
Well, your rib cage moves, and you have, as I said, there's some cartilage in the front, and the ribs they're not horizontal, they're kind of angled, and just sitting here breathing, you can feel that your rib cage moves in and out. But your rib cage is flexible, and certainly the younger you are, the more flexible it is. But it's flexible, so you can compress the chest. Technically, that's what is being done during CPR. But by compressing that chest with a blow to the chest, you can actually compress it to the point where, like I said, the blade, even though it's only a certain number of inches long, can be inserted beyond that depth.
Thank you. Now, I want to talk a little bit about evaluating stab wounds. Is there a way that you're able to determine if a stab wound is self-inflicted or inflicted by another?
We will make note of all of the characteristics that might help to make that decision. And I should insert the caveat here that single stab wounds to the chest are obviously the most difficult. So having a single stab wound to the chest, you have to take into consideration a lot of the things that you observe at autopsy. And but having said that, understand that cause of death isn't a real mystery here. And so my job is to determine the cause of death. To determine the manner of death, you have to go beyond the autopsy. The autopsy is just one set of facts that you use to determine the manner of death, whether or not it's a natural accident, suicide, homicide, or undetermined case. So that requires more information about the circumstances, the scene, the person themselves, and their past history. So from the standpoint of evaluating the injuries, I'll make note, or by not making note, I'm telling you that certain things are not present. So you'll know what kind of factors are present and not present in making a decision on whether or not this is or could be self-inflicted versus a homicidal injury.
So in this particular situation, are you able to determine whether or not it was self-inflicted or not self-inflicted?
No, from my involvement in this case, I can tell you the cause of death, but I am not able to tell you the manner of death.
And as we look at that, there are times where you're able to determine both the cause of death and the manner because it's clear to you.
Yes,
And then there's times where there would have to be an evaluation of much more than just the autopsy.
correct.
And that's the situation that we're in today. Is that fair?
That's fair.
Now, you talked about the cause of death, and ultimately, the cause of death is the finding that you're making related to this particular case, right?
Yes,
And what did you determine the cause of death to be?
a stab wound to the chest.
So everything we've been talking about today.
Yes.
Was there anything else that you noted that could be related to his cause of death, other than the stab wound?
No.
Was there any other, did he otherwise appear to be a healthy person?
Yes, he does have some natural disease, but generally he appears healthy. He does, but as I said, he does have some natural disease.
But nothing that would have related to his death?
But nothing that contributed to his death.
Thank you. And that's outlined in Exhibit 59, which is your autopsy report, right?
Yes,
Now, in addition to conducting the external exam we talked about, the internal exam, you talked about the process of collecting fluid samples or other different types of samples during the autopsy process. Do you remember that?
yes,
And as you talked about this, were there fluids that were also collected for Mr. Carot?
yes, there were.
And was some of that done then through toxicology?
Yes, it's my routine to collect specimens for toxicology on all autopsies.
And you indicated you have a toxicology laboratory at the Milwaukee Medical Examiner's Office?
We do.
Okay. So after conducting those, collecting those specimens, those are then sent to your laboratory?
Yes,
And do you then receive back a toxicology report related to that and to help further assess your autopsy exam and evaluation?
yes,
Do you receive that in this particular case?
yes, I did.
Now, as we look at the types of collections that were done, there is a notation on that, which I believe is the last 2 pages of your autopsy report. Does that sound right?
Yes,
Of Exhibit 59?
correct.
There's a reference to I believe it's iliac blood,
Yes.
and what is that?
The iliac blood vessels are in the pelvis. They are those in the femoral arteries and vein, which are in the thigh, are preferred specimens, mainly because they're more peripheral specimens. They're farther away from the core of the body, and so they can be judged as being more accurate.
And are there specific results that you noted in these results that were of interest to you?
Yes, he does have some substances in his blood.
What type of substances did you find?
So the testing of that blood showed the presence of some methamphetamine, amphetamine, and then there was also some buprenorphine and its metabolite buprenorphine.
And then I'm gonna spell that for the court reporter. So that'd be NORBUPRENORPHINE. Does that sound accurate?
Yes, it is.
And then the bupropion would be the same spelling, just minus the NOR, right?
Yes.
Okay, and what about those?
That's an opioid that can be prescribed, or it can be taken illicitly, but usually it's prescribed, often as part of a combination of drugs that are used in the treatment of chronic opioid abuse. abuse to help people to get off of chronic opioids. In this particular instance, I don't know why they're in the system.
And are those, when you look at the quantitation of those, are those a significant amount or anything that causes you particular concern?
Nothing that causes any concern. They're small amounts, but certainly their presence is of note.
And then you talked about methamphetamine and amphetamine. Before we kind of get into that, to those amounts specifically, can you talk about what happens if somebody consumes methamphetamine, how that turns into an amphetamine?
Yes, amphetamine is a metabolite of methamphetamine. So in other words, people that use methamphetamine, their body will break it down to amphetamine, which is also an active substance. So both of them are active stimulants. But it just so happens that amphetamine is a metabolite, an active metabolite in this case. And then of course, amphetamine will break down further from there. That's the relationship between the two.
When we talk about amphetamine, is amphetamine also contained in other prescribed medications?
Yes.
So might it be contained in something like Adderall for ADHD?
Yes, it is.
So somebody who has amphetamine in their system might also have a prescription that's related to why you see that in somebody's result.
Correct. Finding amphetamine in somebody's blood doesn't tell me, just from that, it doesn't tell me whether or not it's from a prescription or not.
Whereas methamphetamine is not related to a prescription, is that correct?
That's correct.
Okay, so let's talk about kind of that toxicology. Do you also inquire whether or not somebody is on any prescription medications?
I do. Again, as a consultant, I usually ask for that type of information, what kind of prescriptions, mainly for this reason. So it helps us when we get our toxicology back to say, well, that substance that I see is something that they're supposed to be taking. It's a prescription medication.
And did you have information for Joseph Carot about him having a prescription for Adderall?
Well, not exactly. What was the information that was given to me was that those were prescriptions that were found at the scene, but I was not told whether or not they were prescribed to him or not.
Okay, so
Hold on a second, before we get into kind of a transition into the prescription history, we've been here about an hour and 20 minutes, so we'll take a break and a clean transition, but it's still a little bit of a transition, so it's a good time to pause since we've had the jurors in here and the staff for about an hour and 20 minutes. So I'll take a 20-minute break. Once again, leave your notebooks on your chairs and the folders. And we'll see you back in the courtroom about 9:50, 20 minutes from now, roughly. All rise to the jury.
Okay, the witness can be on break too, and we'll come back on the record at 9:50 a.m. You can step out as needed.
Wow. So they going on break. You know, we got our TiVo time, but I don't know. Did y'all find that different that the medical examiner is not able to say a cause of death? Like, it's not homicide, it's not unaliving, it's not accidental. What's up with that? I want them to be able to say But you know, what I want and what we get is two different things. So I'm gonna fast forward. She better not be looking over here at these jurors. She gonna get in trouble again.
That I am going to have objections to several of those calls, and I just wanted to alert the court so that we can perhaps take it up before it happens.
Okay, we'll do that, after the second witness. Okay, anything else from the state before we bring the jury back out?
Oh, thank you.
Okay, we'll bring the jury back out.
All right, all rise for the jury. Okay, everybody can be seated.
All right, we're back on the record in branch 6, Allegheny County Circuit Court, State of Wisconsin, and State versus Krebs is the case. Dr. Kelly is the witness. We're still on direct examination, so we'll have the district attorney continue with her questions on direct examination for Dr. Doug Kelly. Go ahead.
Thank you, Dr. Kelly. I think we were talking about the toxicology results, and we were talking about amphetamine being a breakdown of methamphetamine. And amphetamine can also be a prescribed substance, right?
Yes.
Okay. Now, methamphetamine we talked about is not a prescribed substance, right?
No, it's not something you would find.
Okay. Now, when we look at that quantity of methamphetamine, as a medical examiner in Milwaukee, do you see a lot of cases where people die as the result of taking illicit drugs?
Yes, we do.
And can methamphetamine with a particular dosage for that person potentially cause somebody's death?
It can.
Now, as it relates to this specific case with Joseph Carot, you talked about how he had some methamphetamine in his system. How does that get quantified?
In this particular instance, it's quantified by an instrument in the lab called liquid chromatography mass spectrometry.
Okay, I think I'm asking.
I'm going to say LCMS. How's that?
Perfect. I think I'm asking it in a little bit different way, but that's the instrument that does that. How does it get measured? Maybe that's the right word.
When you say measure, do you mean?
In the quantity of somebody's blood.
Oh, are you talking about the units that it's
Yes.
measured in? Oh, okay. The units are in micrograms per liter.
Now, as we talk about the result for Joseph Carot, does that have an amount that is able to be quantified?
Yes.
And what is that?
The quantity of methamphetamine was detected at 11 micrograms per liter.
when we talk about that, did you have any concerns about whether or not that caused his death at all?
No.
It did not?
The substances found in his blood did not cause his death.
So you see the presence of it, but you don't have any specific medical concern as it relates to your cause of death findings. Is that fair?
That's correct.
Now, the amphetamine level is a higher number. Is that correct?
Yes,
And what is that result?
the amphetamine level was 500 micrograms per liter.
So could that amphetamine level be part of the breakdown of some amount of methamphetamine?
Yes, I guess the way I would put it is that at least some, if not all, of the amphetamine is present as a result of methamphetamine use.
And then could some of that presence also be if he would have taken some Adderall medication?
That is possible.
In cases that you talk about related to the work that you do, are you familiar with death certificates?
Yes, I am.
Okay, I want to show you what's been labeled as State Exhibit 78. Are you familiar with that?
I'm familiar with the death certificate.
And is that for Joseph Carot?
It is.
And on the bottom, does it talk about an autopsy being performed?
Yes, it should. It does, yes.
And is that in reference to the work that you specifically did?
Yes, it is.
And does it indicate whether or not there is a cause of death?
It does.
And what does that say?
Stab wound to chest.
Okay, and then it says interval between onset and death. Do you see that?
I do.
And what does that say?
It says minutes.
So is that information all from your work that you did?
Yes, I would imagine that they certainly would have gotten our report state with my opinion on the cause of death.
Your Honor, I'd like to, for the court to receive that. We're not publishing it, just as an exhibit for the court to receive.
Okay, with those conditions, any objection? No. All right, 78 is received.
Okay, that's all I have at this time. Thank you, Dr. Kelly.
All right, Dr. Kelly, Attorney Kirk O'Bear is to your left, so he's gonna go over some things with you on cross-examination. Once again, take your time, don't be in a hurry, and go ahead, Mr. O'Bear.
Thank you. Good morning, Dr. Kelly. I do have a few questions. And I heard you say on direct examination that you have an opinion with regard to the cause of death, that being a stab wound to the chest, but you do not have an opinion with regard to the manner. Am I right?
Correct. That's correct.
Another way to put that is you cannot scientifically rule out the possibility of a self-inflicted wound here.
As I said, I can't rule out the possibility. I can't tell you what the manner of death is.
And it should be obvious, but it's not your job, nor is it scientifically possible in this case to determine who caused that stab wound, correct?
I'm not able to do that with what I have.
If I were to describe in forensic terms an accidental self-inflicted incise wound to the palm or palmar aspect of the hand or fingers, what would that mean to you?
Could you say that again, please?
An accidental self-inflicted incise wound to the palm or palmar aspect of the fingers.
And what, asking me, what does that mean?
Yes.
That just means that he has that person would have a cut to the palm of the hand somewhere.
Okay. And this is the type of wound that sometimes, not all times, but we will observe on the hand of the perpetrator, the person that did the stabbing, if it were not self-inflicted. Am I correct?
Say that one more time.
This is the type of wound, an accidental self-inflicted incise wound of the palm or palmar aspect of the fingers. That's something that if someone were to stab somebody else and it meets an object of resistance, such as a human body, there can be some slippage and then there's a self-inflicted incise that occurs on the fingers.
I see what you're asking. Yes, it's possible that even from any individual that is using a knife to inflict this kind of wound, there could be some slippage of the knife causing a cut to the inside of the hand where you hold the knife.
Okay, and there have been forensic studies actually, which you're familiar with, but that discuss this phenomenon, correct?
It's something that you'll see in textbooks and occasionally in autopsy.
Mr. Brody, can we put exhibit 77 up, please? Now, Dr. Cully, this is the knife that we were discussing. Now, I'm sure you see all kinds of knives, all different types, am I right?
Yes,
And again, you had said that sometimes you're provided with a variety of different knives, sometimes you're provided with multiple ones regarding one case, but you just have this one knife to look at in this case, am I right?
that's correct.
And you've seen knives that have, not sure what the technical term is, but you've seen a hunting knife that has sort of a stop or a catch surrounding at the end of the handle, correct?
Yes, a blade guard.
A blade guard, that's the right term, thank you. And that's intended to prevent that type of wound we were just discussing to the hand, correct?
Yes,
And this is basically just a regular, kitchen knife without any such blade guard. Can we agree?
yes, it is.
Thank you, Mr. Brody. Now, one thing you might look for to help educate you with regard to the manner of death is the existence of any defensive wounds on the deceased. Am I right about that?
That's correct.
Can you explain to the jury what defensive wounds would encompass?
Defensive wounds are wounds that would be incurred during the process of defending yourself against a weapon. In this case, a sharp force or a sharp type of weapon might result in some wounds to the arms or the hands or even the legs and feet in some cases. Those wounds in those locations, based on the circumstances, are usually referred to as defense wounds.
And you did not observe any defense wounds in this case, am I correct?
I did not.
Now, we had a long discussion about, I think you described, you did not have enough information given all the dynamics here regarding the actual pathway or angle of the blade entry. Am I right about that?
That's right.
So it would be incorrect to speculate as to what angle that may have been.
Correct. I guess I could go further in just saying that if there is some angle in those two planes, it's not a lot, but because of the movement of the heart in the pericardial sac and because of that fact, I didn't feel confident in giving a left to right, right to left, or an up or down orientation.
Very good. Also, there was a lot of discussion about how the actual size of the wound, and you gave some measurements, and you also talked about how the depth of the wound, there can be a lot of different factors that contribute to that. In fact, you gave an example of how the wound going in can actually be longer than the knife in some situations, correct?
Yes, the depth, correct.
So you don't have a way, scientifically speaking, of being able to tell how much of this particular knife entered the body, correct?
That's correct. I can tell you what's possible, but I can't tell you specifically by a measurement or something that I know exactly how.
So, right. So, for example, the depth of the wound was 4.2 centimeters. We shouldn't conclude from that 4.2 centimeters of the knife entered the body.
Correct. Usually, if the wound path is longer than the knife, you'll know the length of the blade, obviously, and you can determine that from measuring the depth and seeing that injuries go a lot further. And so clearly that had to have been compressed the chest. But other than that, it becomes a difficult measurement.
Attorney Temple has asked you a few questions about the existence of Adderall And obviously, we talked about buprenorphine and other things that were found in there. And some of our questions had to do with the possibility that some of the amphetamine that was found could be theoretically attributed to taking an Adderall or some other type of prescription medication, correct?
That's a possibility, yes.
But you also said that given the amount of methamphetamine and the fact that amphetamine itself is a metabolite of methamphetamine, it's not surprising to find this amount of methamphetamine compared to the amount of methamphetamine. Am I correct?
Well, I didn't say that, but I think what the implication is that the presence of methamphetamine would, because it breaks down to amphetamine, would mean that at least some of the amphetamine in his system came from methamphetamine, if not all.
If not all. And again, just so your jury understands what we mean when we say metabolites, and this can happen with a number of different substances. Say, for example, if we're looking for tetrahydrocannabinols, we'll see a delta-9 component, we can see a carboxy-THC component, a hydroxy-THC component. And what's actually happening is the body is turning one substance into another through the metabolic process. Am I right?
Yes.
Okay. So in this case, when we see methamphetamine, and we also see amphetamine, what is the natural process that the body undertakes is it's in the metabolization. It's actually converting methamphetamine to amphetamine. So we'll see less methamphetamine as the body metabolizes it, and then it will convert it to more amphetamine. Am I correct?
Typically, yes.
I have no further questions. Thank you.
Redirect.
Just a couple. Dr. Kelly, when you see, stab wounds that, let me ask this. Do you sometimes see stab wounds that you're able to determine the cause of death to be homicide?
Yes.
And in those cases where you have stab wounds related to homicides, do you always see defensive wounds?
No, not always.
So just because defensive wounds don't exist doesn't exclude it from being a homicide. Is that fair?
That's correct.
And you were asked about an injury to somebody's palm. And that question was presented to you in relation to a suspect who might stab someone. And if there's kind of slippage with the knife, it might, they might get a hand cut. Do you recall that?
Yes.
And as you explain that, can that also happen to somebody who would do it if it was self-inflicted, where they could get an injury themselves?
Yes, I think I mentioned that, anybody who's holding a knife in a certain situation, it can slip and cut. You can cut your own hand with the knife that you're holding.
So that could be either for the person who does the stabbing of another or to someone who stabs themselves. Is that fair?
Yes.
It's just one injury you might see, correct?
Yes.
Are there plenty of cases where that does not happen?
Where you don't,
Where
the
there's,
knife doesn't slip?
yes.
Oh, yes.
And in situations where somebody might have, in a case with multiple stabbings, say in a homicide case, and someone stabs someone multiple times and there's a lot of blood, does that often impact just the knife being slippery?
Yes, that certainly is one of the reasons why the knife would slip.
Now, in this particular case, with the amount of blood that was filling the sac around the heart, would more of the blood have been contained in that sac versus coming out of somebody's body?
That's a difficult question to answer because it really depends on the set of circumstances. I mean, certainly anytime that you create an opening from the skin to a wound site, you have the potential for blood loss. But keeping in mind that your body has cavities and that blood can fill those cavities. So there are cases of both stab and gunshot wounds in which there's very little blood at the scene because it all collected within a cavity. In this particular instance, that's what happened, but instead of bleeding, and as essentially exsanguinating into the cavity, the blood filled the sac around the heart, and that is what created the tamponade, or the effect of freezing the heart's ability to contract. But yes, it's really difficult to determine just from a random set of circumstances whether or not you're going to see a lot of blood at the scene or a little, not a lot of blood.
So you found a lot of blood inside in the internal cavity and the sac around the heart. Is that fair?
Yes.
And you said almost like a can of soda quantity.
Yes, well, a can of soda is a little bit more, but to give you an idea, he had 300 milliliters of blood.
So not quite the whole can, but a good amount of it.
Pretty close to a full can.
And so if there was little blood, well, let me ask this question. There's going to be some blood that comes out if somebody's stabbed, right?
As I said, it's difficult to say that with complete certainty, but yes, usually there is some amount of blood, either whether it's on clothing or whether it's on the skin surrounding. It just depends.
Okay. And if somebody were to say that there wasn't a lot of blood coming out of the wound, would that be surprising with this particular injury?
No, actually it wouldn't, mainly because the blood obviously is collecting in that sac around the heart. If there was a large opening between the sac around the heart and the outside the body, frankly, it would have had a place to go, and maybe it wouldn't have created the tamponade or the freezing of the heart. So I'm not surprised by that, no.
Okay. And in reviewing, if we come back to Joey's hands, did you have the opportunity to review or to examine his hands?
Yes, I did.
And did you notice any injuries, any knife wounds or injuries to his hands?
I didn't. He had the palms of his hands, he had some, and I don't know what he does for a living or anything like that, but the palms of his hands had kind of some cracking, like they were dried, and I did take a couple of photos just to show that it was the cracking, but there wasn't any cuts or blood on his hands.
I don't have anything else, thank you.
Very briefly, just go ahead and Ross.
Dr. Kelly, Attorney Templates just asked you a few questions where she utilized the term homicide. And I want to be clear here. It is not your opinion to a reasonable degree of scientific and medical certainty that this case is a homicide. Am I right?
Correct. I'm not giving an opinion on what the manner of death is.
No further questions.
Anything else?
No, thank you.
Okay.